Going in the wrong direction. The latest figures for COVID in England's school children released this afternoon show they have reached a record high, while hospital admissions also went up, with the highest rates in those aged 85 and over. Separate data showing the majority were unvaccinated. It was a grim reminder in a week dominated by headlines over pressures on the NHS.
Please remember, we're all elected here, not in the corridors of Downing Street or on the front doorstep.
Addressing down for the government over their COVID press conference last night, so an urgent question was granted to Labour today.
To ask the Secretary of State for Health and Social Care to update the House on the government's response to COVID-19.
The Health Secretary wasn't actually there. In his place was the Vaccines Minister, only appointed 6 days ago.
The purpose of the Secretary of State's press conference was to appeal directly to the public to come forward for their vaccines, including the 4.7 million people over the age of 18 in England who haven't accepted the vaccine, and the need for those eligible to take up the offer of a booster jab as we pursue Plan A to its full extent.
Defying calls by the growing number of health organisations to implement Plan B, and that would include wearing masks. Promoted, apparently to Downing Street's surprise, by the Health Secretary last night and rejected by the Commons leader today.
I would say there's no advice to wear face masks in workplaces, and the advice on crowded spaces is with crowded spaces with people that you don't know. We on this side know each other.
Sidestepping further disagreements over masks, however, Number 10 today said there will be an advertising campaign launched next week to encourage booster jabs. But one government advisor criticised the mixed messaging.
The mixed messaging exists at various levels. I mean, the first and most basic point is that for people to take any measures, whether it's getting vaccinated, whether it's keeping their distance, whether it's wearing masks, whether it's limiting their social mixing, depends upon a sense that infections matter. And if you send out the message that infections don't matter, then what on earth is the point of doing anything about it?
Yesterday, Channel 4 News was in the intensive care unit at Northumbria Emergency Care Hospital, where 5 of the 6 patients had not been vaccinated. And the data from the Office for National Statistics is stark. Of the just over 51,000 deaths between January and July involving coronavirus in England, only 640 were patients who had been fully vaccinated, and that included those who'd been infected before they received their jab. That's 1.25%. And new figures on COVID hospitalisations across the UK show they are far more likely among the unvaccinated, with admissions among every single age group dramatically higher. And concerns over the low rollout of the 12 to 15-year-old vaccinations also means that from next week, parents will be able to take their children in England to vaccination hubs rather than waiting for the school service, similar to Scotland, where their rates are nearly 3 times higher.
Victoria MacDonald with that report. Well, today's Wales unveiled its COVID winter plan as NHS chiefs there warned of one of the hardest winters in history. Our Home Affairs correspondent Andy Davis is in Cwmbran in South Wales. Andy.
Well, wherever you look right now, across the NHS in Wales, there appear to be alarm bells sounding, whether it's a recent report looking at how ambulance handover delays are having an effect on patient safety, or a leaked report yesterday claiming that there is chronic understaffing at this Wales's newest hospital. Today, 17 medical royal colleges and faculties urged the Welsh Government to, and I quote, end the unsustainable pressure healthcare workers face in Wales. Then we get the statistics, the NHS in Wales performance statistics, which make for particularly grim reading, with A&E waiting times, among others, the worst on record. The Welsh Government has published its winter plan, promising to focus more on getting people vaccinated, on easing pressure on hospital beds, on the ambulance service, on funding an extra £42 million to social care. But it comes with the bleak admission that some of those many patients in Wales waiting for operations may yet face further delays this winter.
we're already experiencing massive pressures at a time when staff are frankly exhausted. So we are trying to get people to understand that they have a responsibility as well to take up their opportunities of having the vaccine, particularly the booster that is being offered to people, and their flu vaccination, but also to understand that we may need to flex the system as we head into winter. And what that may mean, I'm afraid, is that we may need to cut down on some operations that people were due to have.
No plans to raise the alert level in Wales. The restrictions stay as they are. It's a Welsh Labour government plan, of course, criticised by the Welsh Conservatives today as a copy and paste failure from the previous year. Whatever you make of this plan, it has an enormous amount of work to do to address these problems, not least that recurring theme of staff morale within the NHS. And one consultant told me today, we're running on fumes, some of us. We know we've got the job to do. We know we've got to do it. It's just a question of how many of us will be left standing when the winter's over. Thanks, Andy.
Well, we're joined now by Professor Devi Sridhar, Global Public Affairs, Public Health Professor at Edinburgh University. Professor Sridhar, these figures today, I mean, 4.7 million worse than we were. I mean, we haven't had these figures since June.
Yeah, we are in quite a fragile position in the UK, and what we need to be doing is looking at other countries at similar positions to ours and learning how are they controlling COVID. If we do not control COVID now, we will face a winter lockdown. So now is the time to move to Plan B, to get face masks in place, to ask people to work from home, to get vaccine certification, to get that uptake higher, and really keep, as we've seen from the statistics just shown, try to get people vaccinated and protected for themselves.
Do you imagine that many of these unvaccinated people are in fact anti-vaxxers, or are they simply people who've not bothered to go and get a jab?
Yeah, so unfortunately, because of some of the early kind of comments about the virus just being dangerous if you're over 80, just affecting you if you're very vulnerable, there is a sense of, oh, why should I get vaccinated if I'm under 30 or under 40? And the truth is ICUs do have people in them who are under 40, and that is creating a burden on the NHS because the NHS has to anyway survive this winter, but now it has COVID on top of it, and staff morale is low, there is burnout, and they're limited resource, and they're a precious resource, and we need to make sure that we do everything we can to keep the load off of them.
Now, the British Medical Association says the government's refusal to bring in tighter restriction in England to head off the winter crisis in the NHS was willfully negligent. Is that something, given that the BMA is sort of one of the sort of agencies you might subscribe to, do you agree?
Yes, if we want to avoid a winter lockdown, we need to put in mitigations now that other countries are doing to keep their economies open, keep people in jobs, keep society going. Let us mix, let us enjoy our lives, let people work, but in a safer way. And we have vaccination now, we have testing, we have masks that we know stop transmission indoors. There are ways to combine these to make sure that we can make settings safer, such as restaurants, bars, nightclubs. So now's the time to start thinking about that and learning from Germany, France, Norway, Denmark. There are many countries we can look at and say, what are they managing to do to keep those numbers low as they go into winter?
With so much misinformation around COVID-19, isn't the onus on the government to be really clear about what the public should be doing to help?
Yeah, I think right now we've left it in a situation of, oh, it's your discretion. And the problem is that people think if the government's not mandating it, that it's not important. But actually, we do have mandates in public health policy to protect people from different things. We have regulations, which means you can't drink and then go driving because you can endanger others. We have regulations around secondhand smoking, which means people can no longer smoke inside bars and restaurants because the smoke affects others. And I think that's the way we need to be looking at COVID-19. I wear a mask to protect you. You wear one to protect me. And actually, as we go into winter, if we want to keep transmission down and keep society open, nobody wants another lockdown. What can we be doing at this moment in time to communicate that clearly to the public by saying, this is what we're telling you to do, and this is why, and this is what other countries are doing, and this is how we can stay open this winter?
What do you make of the anti-vaxxers? I mean, are they a serious force, or are they actually doing what almost amounts to criminal damage?
Well, it's costing people's lives, and that's the honest truth, because you are seeing people appearing in hospital either at that point begging for vaccination, saying, no, I want to be vaccinated now, but obviously it doesn't work like that. It's not a treatment. Or having people, even when they're on ventilation, saying it's a hoax, there is no COVID. And so I think it's really sad that we're at this moment in time. I think it has been said that if we had this misinformation around, we never would have, eradicated smallpox. We wouldn't have eliminated polio. We wouldn't have been able to control the infectious diseases in the past.
Well, now, very briefly, given the high levels of COVID-19 in the United Kingdom, is the COP summit a super spreader event in waiting?
Well, it's really difficult because I know that those behind the scenes have been working to try to put in the mitigations of vaccination and of testing and of physical distancing and all the things. But in the end, yes, I mean, if you have an event of 30,000 official delegates, thousands more people coming into the country, protests, all of that happening, it will result in a spike in cases. And the question then is at that point, can we contain that spike quickly, or will it lead to a larger wave? And so I can only speak on the pandemic front. I know climate change is a hugely important issue, but obviously it's difficult timing with an infectious virus right now that is causing us problems.
Professor Devi Sridhar, thank you very much indeed for joining us.
Thank you.